Hi, I'm Dr. Dan Maring. I work as a primary care physician at Family Medicine Zealand for Holland Hospital. And I'm here to talk to you today about staying healthy, nutrition, and how primary care can help you do that. Most people, men included, will need to access the healthcare system at some point in their lives, and this increases in probability as we get older. The first point of contact is often a PCP or places like an ER and urgent care. However, PCPs can often address acute concerns, thus saving a trip to an ER or an urgent care, and having a PCP can help you determine whether or not you need a higher level of care for a concern, rather than going there and maybe not needing it. A primary goal of primary care is to have a relationship with the patient and to build trust and rapport. And when we make recommendations about health screenings or medications or nutrition, all that is done within the context of the whole person, taking into account their background and their preferences and their goals to stay healthy. A recent study came out about the importance of primary care and showed a statistically significant decrease in mortality for those people who had greater continuity with a primary care physician. So at a typical annual physical, your health history is updated. We note any changes to your family history. We gather information that might help determine your risk of certain infections or other diseases. A physical exam is typically performed, focusing on each body system. And then this is followed by education on ways to stay healthy, age-appropriate screenings for things like cancer, diabetes, hypertension, certain infections, and then kind of age-appropriate education about preventing falls or proper nutrition, things like that. We also ask about things that, lifestyle factors that might positively impact your health, and then we also might talk about things that might negatively impact your health, things like smoking or diet or lack of exercise, and address those things. So I think for most people, a whole food, plant-based diet is ideal. Generally, people are recommending a Mediterranean-style diet for the prevention of heart disease. And this diet focuses on whole plants, fibrous vegetables, and healthy fats like foods that are rich in omega-3 fatty acids, so oily fish and nuts and legumes. That seems to be a diet that leads to better outcomes. So, and then avoiding processed foods and large amounts of saturated fats. You know, this might be an overgeneralization, but I think men typically will go long periods of time, especially in their young adult years, where they feel well, they're early in their professional careers, or they're working lots, they have young families to take care of, and they don't find the time to get established with a primary care physician. And I would encourage that group of men to just get established and have somebody that they can turn to for questions, or if something comes up, and to be seen every couple of years. And I think building that relationship over a long period of time, especially when you're young, can really have tremendous impacts for their health as they get older. I think prevention is really key to long-term health, and so young men who typically don't go to the doctor should get in, even if they feel well, even if they're healthy. I think it's important to have somebody to partner with to keep them that way.